Even with vaccines, it is still imperative we make moves to slow the spread. As we reported, the U.S. recorded more deaths from coronavirus yesterday than people killed during the attacks of 9/11. And we can't get numb to that number and to any of this. The people dying are mothers, they are fathers, they are brothers, they are sisters, they're your loved ones, they're your neighbors, they're the people who work in your grocery store. My next guest says ramping up access to rapid antigen tests could stop this by Christmas, before we get a vaccine. Let's bring in Dr. Michael Mina. He's an assistant professor of epidemiology at Harvard School of Public Health. That is a big promise, doctor. How exactly will antigen tests help us?
Yeah, the point with antigen tests is that we need to get as many infectious people out of the community as we can, as quickly as we can. The testing and the type of testing we've been doing recently has not been working. It's delayed too long, and so by the time we actually get people their results, they've already transmitted to other people. So if we can get enough rapid tests into people's homes so that they can take them, say, twice a week on their own, in their privacy, they can actually find out before they have symptoms, or some of them will never get symptoms but will transmit. They'll be able to find out that they're infected, be able to self-isolate because they're actually seeing the result right there in their hands. And they can make behavioral choices that will help them to not infect their loved ones and their friends. And that's essentially how we stop spread of a virus.
That does rely on people, though, taking personal responsibility and not going out if they do test positive. Have you taken that into account?
Absolutely. We know that some people will not actually abide by the results. If they see a positive, they'll still go out. But I feel firmly that a lot of people will, and especially if they don't end up doing it for the whole 10 days, if they just stay home for 4, that is a huge gain already in terms of reducing transmission. That might reduce 80% of it. And, it doesn't need to be perfect. If we have just 50% of people who are participating choose to actually abide by those, then every day we take out a bigger and bigger sort of relative fraction of infecteds, and that's how we get epidemics to not go up exponentially, but to start decaying exponentially and drop down.
It would be incredible to really stop this before Christmas. Why haven't we done this yet? Do we not have the resources in place? Do we not have the money? What's stopping us?
Well, there's nothing technically stopping us. I mean, we have an amazingly innovative and powerful country with all the money in the world. If we wanted to put this in place, we could have. We have been so laser focused on a vaccine that we have essentially disregarded the tools that we have in front of us right now that are safe, that are effective, that we could be making in the tens of millions every single day, so that we wouldn't have these lines. We would have people being able to know if they're infected today. We have to scale them up. We really need Congress in this next bill to pass $1 billion specifically for the manufacturing capacity of these tests. $1 billion sounds like a lot, but it's 1/5,000th of what has actually been spent on this virus so far. So it's really, it's a small chunk of change to actually get these tests into the hands of every American.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.